So today is a special treat. Esther Dyson is on her way back from her meeting at the
JP Morgan.
JP Morgan meeting, which is the largest medical strategic planning meeting. She can tell us more about what it is in a minute. On her way back from there to New York, and she agreed to stop by and have a chat with us about what she's been doing for the last few years. But before we talk about that, we're going to talk about her remarkable, diverse set of interests, starting off as an economist from Harvard, and then working for Forbes and doing journalism. She still does journalism sometimes. You read her stuff in the HuffPost and elsewhere. Anybody who was back in my age read Release One. Release One is what you read if you wanted to keep up with what was going on in Silicon Valley. And that was her entree into more publishing and a company she founded called Adventure. Adventure she ran for 20 years, right?
It's complicated.
And now she claimed the name again after she sold it to CNET.
Yes, precisely.
Right, and but I'm just trying to give you a flavor for this person who, you use URLs all the time, and where do they come from, and who decided how it all works. She was the chair of the committee that started all of that. Among other things, she trained to become an astronaut, and she was a backup on the Suez mission. Didn't get to fly, to her disappointment.
No, I mean, I bought the training, and I got the backup as kind of a lottery ticket attached.
I see.
But the point is, kind of the training itself was really a worthwhile experience.
Right. So as you can tell, this is not going to be a PowerPoint slides kind of talk.
Yeah.
Today is going to be a discussion with you all. I'm going to ask her to talk a little bit about her plan, her project related to health, which is really quite revolutionary. She's decided to see if you decided to really improve health in American communities, what could you do? Our center, I've emphasized to her, has as its mission to improve human health by bringing evolutionary biology to bear on problems in medicine. And we're all very curious about how useful we can be as evolutionary thinkers to improve human health. And we think there are opportunities to learn from some of the challenges she's faced in these communities, and there might be opportunities for collaboration as well. So instead of me going on, I'm going to ask her now to talk first a little bit about how that means she can do anything. Why is she doing health? Everybody else has challenged health. Why take on such a challenge? Let's start there.
Okay.
And I'm going to adjust your microphone so people can hear it.
I think it's not.
Just move it up a little bit.
Okay. Yeah, you're right. Let me do this. So indeed, what I'd actually like to start with is just a brief show of hands. How many of you think you're going to go into science academia? Okay. How many of you are going to go into some kind of medical practice direct work? How many of you are going to be business types? What else? Public defenders, crusading journalists? I don't know. Do you mostly feel covered by those things?
Professional hockey players.
Professional hockey player? Okay. So I'll run through. Yeah, I've had an amazing, extraordinarily eclectic, lucky life. My mother was a mathematician. My father is a physicist. I wasn't really an economist from Harvard. I majored in economics and spent all my time writing for the Harvard Crimson. And then basically did intellectual dishwashing for 2 years, became a fact checker for Forbes magazine for 3 years, worked on Wall Street for 5 years. So I understand what actually happened at JP Morgan, which originally was a bunch of public healthcare companies talking to investors. And that event blossomed into kind of a metastatic organism that takes over San Francisco and created its own microbiome of other conferences. So it was just a week of craziness. So healthcare after technology just felt more useful. Uber did not exist back in 2007, but there was a lot of useless stuff going on. Pets.com and apps, and even apps kind of waited for more.
Just for you, the 20 or so companies she's been involved with.
Yeah, and I won't. So, but I decided I wanted to do something slightly more useful as well as intellectually interesting. Got interested in healthcare. And if you think about healthcare at all, you have to start wondering, why are we spending so much money fixing things that are broken instead of keeping them healthy or making them more robust in the first place? And if there's a book I could recommend, it's Anti-Fragile by the same guy who wrote Black Swan, Nicholas Nassim Taleb. If you read the book, you think, what an obnoxious guy, but what a brilliant guy too. And basically the concept is resilience, anti-fragility. What is the most benign form of stress? It's a question. Anybody want to venture an answer? Exercise. That's real stress, but if you have it in the right amounts, modulated correctly, it makes you stronger and more resilient. And if you spent your life never worrying about anything, you probably would become pretty useless. So you need a certain amount of whatever it is to strengthen you. Your immune system needs to be stressed. And we can, everywhere I go, I find these crazy hand sanitizers, and they bug me almost as much as Coca-Cola bugs Randy. Anyway, in May of 2013, I was about to give a talk, sort of like this, random remarks, and I thought I would talk about how somebody should do an X Prize for health rather than the X Prize for healthcare, which actually almost happened, but then didn't for a bunch of reasons, and realized somebody should do something is not as compelling as, ladies and gentlemen, allow me to announce. So we started the Wellville Project, which was going to be 5 communities, 5 years, 5 metrics. The thesis was find a community, because that's where you get healthy. You get fixed in the healthcare system, but you get unhealthy with toxic parents, toxic environment, bad schools, bad neighborhood, lack of places to play or exercise. So find a community, find 5 communities that are small enough to be genuine communities, so you can work with the community rather than with some subset where people go in and out all the time. Find some group that's already doing something, so that it's not a nice white lady who shows up to tell you how to live, but a team of people who come in and help you do what you're trying to do, but do it more effectively, more accountably, with outcomes. And because my resources were limited, even though they seem rather large, I got lucky with Facebook stock. The community should be under 100,000 people. I went and hired a CEO, and so I did not actually run Adventure. I hired a CEO there too. Being CEO is way overrated. It's kind of like macho, I'm the CEO. The fun part is leading the vision, going out and talking to students, as opposed to dealing with the real estate and the hiring and the payroll and talking to the accountant and the lawyer and so forth. Found a CEO who had done public health at Cigna, and we put out a call for applications for communities that met those criteria. This was in 2014. To our amazement, we got 42 community. So it was a community group, some kind of cross-sector collaborative. There had to be somebody to apply and to kind of sign the document. And we read all these multi-megabyte applications with, this is our community, our demographics, what we've been trying to do, our problems, our challenges, our successes, and picked 10 of them to visit in the summer of 2014, which, forgive me, was probably better than 3 semesters, even at ASU. And picked 5. So 5 years later, it's now a 10-year project instead of 5. One of the communities we switched out. The ones that we have now, and raise your hand if you've been there, know them, whatever. Spartanburg, South Carolina, North Hartford, Connecticut, which didn't quite fit our notion of a discrete community. It's sort of the poorest part of Hartford. Muskegon, Michigan. Oh, great. We can talk later. Lake County, California, which is known as the meth capital of California, and Clatsop County, Oregon. So all under 100,000 people. Muskegon County is actually 180, and there's another story there, but we let them in just the way you might let somebody get into the Army early. Missing middle class, a bunch of nice people trying to help out, often trying to do things for the community rather than with the community. And mostly, it's not that the money is flowing, these are poor places, but at the same time, the big problem is less the money and more spending the money effectively. It's easier to get a grant than to actually administer it effectively and build something. So the mantra is moving from short-term to long-term thinking. We don't give them fish. We don't teach them how to fish. We're helping them to build their own fishing schools.
So that's a nice point to pause a moment. And we're going to open this up to other people's questions and comments very quickly. But
I'm not sure your mic is working.
That's because I'm not
I'm holding it. Got it. I thought you had a secret mic in your...
Now we can hear. In a moment, we'll open it up for other people, but can you just give a 4 or 5 minute summary of what you've actually done with these communities?
Okay.
What's working and what's not working?
Right. So we picked them in 2014, and we kind of formally launched in 2015. But again, we were going into real communities. We weren't trying to construct a new community like Sidewalk Labs or some model community. This is real people, real places. They're not experimental subjects. And if the people in these communities have never heard of Wellville, it doesn't matter. We're trying to change their communities. We're not trying to have a branded program that will cheer them up or whatever. As I said, we went in thinking we'll have these 5 common metrics and the communities will all do sort of the same thing. And turned out what we have learned, first of all, these communities are as different as 5 children, including that we don't have a favorite one. They all, children all have to learn how to speak, how to walk, how to go to the bathroom, learn how to read, and so forth. There's all these common things, but you do them in different orders with different mechanisms. All our communities have problems with child abuse, inadequate parenting, economic distress, mental distress, obesity, lack of access to healthy food, things, asthma, just all these environmental causes, all the social determinants of health. And in each community, there's probably 20 potential programs/partners we could have worked with. So first, we had to work with the people that brought us in, and we discovered that they probably were not the ideal people in the first place. And this is the part when we do the documentary that will sort of be lost in the mists of history. There's been some changeover of people. Organizations have been restructured in Lake County, for example. The Lake County Health Leadership Network gave way to something called Hope Rising, which is a joint venture between the 2 hospitals and the insurance company, Partnership Health, which is really great because that's a nice source of enlightened money. In other places, different structures and restructurings and so forth. The identity of the institution was different in each place. But so we worked with them, and over 4 years have discovered whatever the program is, if you want to do this in a new community, go after the program that's going to be successful, that's doing something useful. It doesn't matter what it is, because that success spreads. many of these communities just feel nothing really works. We can't really change anything. So find the ones that are working. In Muskegon, which is, I do Muskegon, each of our communities, we have one of our team of 6 works in one of them, and then there's one team member who kind of works with us. So in Muskegon, it's the YMCA's diabetes prevention program and the mental health program organized by Health West, which is the state mental health outfit. In Lake County, it's Hope Rising, which focuses on homeless vets and opioid reduction. And in each of these places, we're beginning to see the building of capacity, which is a very anodyne term, but what it means is in one of the communities, they have 30% obesity among 3rd graders. And they told us they want to reduce that by 3%. So I asked, do you mean 3% or 3 percentage points? What is the difference? So now they know the difference. It's stuff like that. And we're at the point now where we think we can start with a baseline, and we've just hired an evaluator person to design the evaluation, and then we will hire the evaluation firm to follow us for the next 6 years and follow the communities. The pitch we're making to the communities is, these people are not here to test you or grade you. They're here to analyze you and give you useful feedback so that you can be better at raising money to continue the work you're doing. It's just like, you have to be really careful to get people to appreciate your efforts rather than feel that we're here to criticize them. And they now consider us their friends, and we're so much their friends, we can't do that criticism and so forth, but we're moving towards getting a bit more rigorous. Actually, so Lake County went and bought themselves a data dashboard system. It's that kind of change in thinking and willingness to actually start looking at their numbers with a mindset focused on how do we improve this stuff rather than, oh, gee, this is embarrassing, let's not mention it. And that's kind of where we are. I mean, the diabetes prevention program has some numbers that are really impressive.
So what are the metrics you're measuring?
That's what the evaluators, I mean, anything that is funded is going to have its metrics. Most of these metrics are things like hours of trauma-informed training delivered, as opposed to reduction in police calls to the school or an increase in graduation rates. And you need both. But we do not, in the interim period, we thought, oh, there's something called the Institute for Healthcare Improvement. And we thought, great, we'll use their metrics. Because ultimately we want metrics that are not ours, but external, so that we can't be accused of or succumb to focusing too much on the metrics rather than the overall improvement. I mean, long run, my metrics are employers attracted, unemployment rate reduced, even more important, workforce participation increased, reductions in. So how many of you know about Rolf Halden's work here? Analyzing sewage to detect usage of opioids. Okay, to me that's a lot more interesting than did the hospital stop prescribing opioids? Are they actually using fewer opioids in the community? A proxy for maternal health is reductions in NICU, neonatal intensive care unit use. There's all these useful numbers, but ultimately something that will make the community feel proud, something that will make people want to move into the community. The community's mission is to be a great place to live. Our mission at Wellville National is to have data scientifically validated and stories to change public opinion so that we start paying collectively, that means through taxes, to invest long-term in people's resilience. So I'm being squishy on the metrics because we don't have that finalized. And that's why we're hiring an evaluator, because we want to tell them what we need, but we also want them to come in with their scientific validation, credibility, et cetera, et cetera.
So should we open it up more?
Yeah, great.
So at this point, we can open up the discussion, and we have one special visitor today, and we're going to ask him to talk first. Dennis Cottese has visited our center repeatedly, but we've never had a chance to get him to give a talk. We will do that sometime. He ran Mayo Clinic for a long time, but recently, being at ASU, he's been a consultant doing the parallel part of what she's been doing. He's been going to different healthcare systems and talking with them about how can you actually change what you're doing to actually improve health instead of just to make money. And I'll pass the microphone to him.
Randy, gosh, I didn't know you were going to do that, but that's good. Esther, I followed your career for quite a while. I mean, it's amazing what you have done. And this Wellville thing, when it got kicked off several years ago, we actually looked at that very closely, and I congratulate you on tackling some really tough stuff that you're doing. I'd like to hear you make a couple of comments, but first let me preface it. The idea of the metrics being based on the Institute for Healthcare Improvement is something to watch very carefully, because those metrics are usually measurements of process, what actually is being done, and the literature, gosh, they got started 20 years ago with that. The literature through the 2000s and more recently too has shown that even though processes have changed, the outcomes haven't.
Yeah.
And it's been in healthcare delivery. Now, I don't know about communities, but that's an important thrust that gives, when that's recognized, then we have found that individuals who now have decided that this was their own idea, particularly locally, begin to make the adjustments they need to try to get the outcomes that they were really, like you've listed, they're trying to get to, is a huge plus. And that's an evolutionary process. That's a learning process of what it is. It seems like I have basically process improvement is a series of hypotheses. My hypothesis is if we give people, when they hit the emergency room, aspirin when they come in, they'll do better with their myocardial infarction. But the outcome that's measured is the outcome of the myocardial infarction, not a check mark to say they got the aspirin.
Right.
So it's very important as you look at this to get people to own it to the extent that it evolves. So I'd wonder, in this 4 years that you've been doing this, what is it that you've learned that it takes to get some success for an outcome that you're aiming for? You must have got a little bit of a snapshot of what is it going to take, and it won't be the same for every community. I understand that. Do you have any feeling for that yet? What does it take to get the success occurring?
So, first of all, you're totally right about IHI, and we've abandoned that idea. But I mentioned to Randy this morning, and another little facet of my life is Russia.
I know.
Yeah, I went there in 1989, and you could not make an appointment with anybody. You would call and say, I'll be there in 2 weeks. And they'd say, okay, call me Monday of the week. And maybe, as you suggest, we can have lunch on Wednesday. So you call them on Monday and they'd say...
Try to get an appointment for Medicare or Medicaid today.
Yeah.
And you're like in Russia.
Exactly. But this was even more in the culture. I mean, and it was never really clear. Were they hoping for a better offer? Or were they just thinking it probably wouldn't work out, so why commit? And there's just this mentality of insecurity, short-term thinking, lack of sense of agency. And the thing, I'll go back a bit, sorry, but the one thing I've really learned a lot about that was a surprise to me, and yeah, I went in this thinking I was going to do good, but not that it was going to be an exciting intellectual exercise. And that it is, in fact, intellectually exciting. I spent a lot of time learning about addiction. I read Sam Quinones's Dreamland about the business models. I read Gabor Mate, Van der Kolk, and a book by a guy called Mark Lewis called The Biology of Desire. At the end of this book, he says, addiction is a really strange thing. He told four or five stories. He's both formerly addicted and a professor of neuroscience. But my next book is going to be about time. So the nut of it is, I would formulate it as short-term desire is addiction, long-term desire is purpose. And addiction, you're focused on relief. You're not focused on pleasure. It's much more relief. And there's another book called Lost Connections. Addiction it's a learned response to bad circumstances. It's not it can become a brain disease with various substances, but it's a reaction generally in some form or other to the environment. And kids become vulnerable to it if they grow up in insecurity with, again, the social determinants of health, adverse childhood experiences. So you become focused and you lose your sense of agency. You lose an ability to perceive the future. That happens to individuals. It also happens to organizations and communities, and they become addicted to pilot programs. They keep trying, the same sense of relief. Oh, we got the grant for $50,000. Now we can employ the part-time coordinator. Yeah, last year she was doing Zumba classes for ladies. This year it's art classes for high school seniors. But she's got a job and we've got a grant. And nothing happens. So what we're trying to do is, with the institutions we're working with the ones that have, you walk in and you talk to people, and every once in a while you say, oh, here's a grown-up. No offense to anybody who's either past grown-uphood or anti-grown-up, ANTE grown-uphood, but someone who has a sense of purpose, measures the outcomes, strategizes beyond the next year, knows what they're doing, and those are the ones we go after, and we try and help them connect more with other people in the community. It's amazing in a community of 67,000 how many silos there are. People doing redundant things, people who are good at raising money but not really delivering. And I'm an outsider. That's important. I'm not trying to get anybody's job. I have no vested interest. I'm not being paid. I'm not handing out money. So I can just kind of move pieces around. Mostly I just introduce people in the community to other people in some sense. And then I bring in outside, whatever, curricula. Ultimately, we hope sources of money to do things long term. But that's sort of our modus operandi, and it's very, very specific. Our CEO, you'd love this, Randy, calls it emergent learning. Probably the biggest mistake I made personally was getting excited over vaccine prevention because it just seemed like a simple, interesting thing to do. But nobody's heart was in it, and it was basically a flop. Fortunately, it was
What kind of prevention?
For flu.
Oh, vaccine.
It's just like I thought this would be fun. Somebody from Walgreens was interested, and it just didn't work because there wasn't a group in Muskegon that was really excited about it, and that was early on. Yeah, sorry,
Good.
I'll be brief too.
No, you got very close. I just want to just push you just a little more because I think you're saying what I'm going to ask you, and that is that there's a saying that there's a Chinese quote that goes back years and years and years and years ago, but it has to do with about visionary leaders getting people to understand where they need to go. I'm not giving you the quote, but that's
Yeah.
the concept, versus dictators or people who use power and control structures, etc. And and in healthcare, I have seen this in spades. I call it the rule of 8. You have to talk to people about what a vision could be enough times, 8 times, and to the same people, same comments, 8 different times in 8 different locations. That's the way I look at it. To the point that after time 7 or 8, 6 or 7, they're sick of hearing you. 7 or 8, they're starting to wonder, hey, this was really our idea.
Yes.
And once they take that idea as their idea, that's kind of, it feels like weak leadership. Visionary leadership feels weak. But it only works in a successful, sustainable way if it gets transmitted and people buy into it and own it.
Yes.
Have you had examples in your 5 cities of a program or two where the people have actually owned it or carried it forward?
Well, I mean, take the DPP program. So I asked, imagine you had as much money as you need. What would you do? Well, we'd hire 2 more counselors. And I said, imagine you had really enough money for the total demand in Muskegon, which is a community or multiple communities in a county of 180,000 people. So, maybe 30,000 people are probably pre-diabetic. Oh, so ultimately we should be serving 30,000 people. They're now in the process of training, I think, 10 or 12 counselors. And, they got, long story, and this was not our doing, but probably a couple of the questions we asked helped it happen. They're part of a grant to the Mercy Hospital System from the CDC to deliver DPP, the Diabetes Prevention Program. In 5 of the Mercy missions, they're doing it with their own nurses. In Muskegon, they're doing it through the YMCA. And what excites me about this is there's kind of 2 channels of transmission now. One is Mercy itself, and the other is the YMCA all across the country. And so our goal is to be successful in Muskegon and then have other people copy it. So, yeah.
So it becomes an organism that evolves, I think is where we're going. Some of you are wondering what the heck all this has to do with evolutionary biology, and I'd like to just frame that a little bit for you. The part we've done so far is more about the evolution of systems, and Denny and I have had interesting conversations about how healthcare systems evolve to adapt to whatever ecology they're in, and they generally follow the money instead of following improving healthcare.
That's metabolism.
Yeah.
Money.
Right, it is. I'm especially interested in the large-scale thinking people like this offer us in terms of how systems say they're doing one thing, but actually they continually devolve back to get whatever resources are available in that environment. So I'd like to ask her to comment on that a little bit and how we can, I'm going to challenge you a little bit. Tenures could still be seen as a demonstration project unless it survives in the long run. But after that, I'd like to turn to the other half, which is that the problems that are being dealt with are almost all problems of living in modern environments. And our human wishes that have also evolved, and you can tell people, please quit drinking Coca-Cola, and it doesn't change anything. So I'd like to call on some of our faculty in a moment to comment on that, but first, any last brief comments about how you can create something like Wellville that itself evolves and survives?
Yeah, I got it. So, I mean, this is the magical question. Yeah, if we can't get sustainable funding, we can't sustain this. And really, I think this country, as a country, and this is probably one of the worst times to believe in this. But yes, this is not something Muskegon can do for itself. Ultimately, it needs Medicaid waivers. It needs, if you like, Medicaid Advantage. It needs governments that will indeed tax people who have money to put it into things that are fundamentally for people who do not have money. And I can sit with an economist and tell you, if you're a rich guy who doesn't want to pay taxes for all these poor people, you'll actually be better off in 10 years because you, with your business, will be able to hire more productive employees. You'll be paying lower taxes for sick people because more people would be healthy. You'll have more healthy customers to buy your products, whatever they are. You know, think long term, dude, because it's not just the poor people who think long term, it's the rich people. And anyway, that's the ultimate mission. We are not going to do it on our own, but we want to join forces with other, you know, all the other right-thinking people who want to think long term.
It's so impressive to hear this long-term, large-scale thinking and to get us out of our little boxes about one small thing. On the other hand, again, the disorders we're talking about, whether it's atherosclerosis or autoimmune diseases or cancers and the like,
Or diabetes.
or diabetes, I mean, these are disorders that are much more common now. And we think there are opportunities to combine the kind of expertise we have in our center and the kind of opportunities with studying these communities to figure out more about what is it about both modern environments and our human nature that makes it so hard to get people to do what might make them more healthy. And I'm going to call on Ben Trumbull because he works with people who do not have modern medical care and they don't even have Coca-Cola.
Sometimes. So one of the things that interests me is kind of what are the conditions that actually have plagued humans forever? Because we live in a really weird environment right now. We live in a really weird environment right now. So 99% of human history, we were hunter-gatherers. If you compress human history into a single year, then we were hunter-gatherers in January, February, March. We were hunter-gatherers until December 31st, and then at 11:40 p.m. we moved into cities. So this is the tiniest amount of time. Yet our bodies were shaped through all these selective pressures that occurred in a very different environment. And so now you can't point to any single population and say they're the ideal exemplar for human evolution, because human evolution occurred in a variety of different environments, but we know that cities are not that environment. So I work with a group called the Chimane, and they're forager horticulturalists in the Bolivian Amazon. So they have no electricity or running water, small family groups of about 30 to up to about 500 people, slash and burn horticulture, hunting, and fishing. So like if we want to go get some meat, we can get in our car and drive to McDonald's, and you can get 2,000 calories out getting out of the car. But for the Chimane, the average hunt lasts 8.6 hours and covers 17 kilometers, so like 11 miles. And even then, it only has a 60% chance of being successful. And so one of the things that our research focuses on, we have a large group of researchers and cardiologists and Alzheimer's experts, and we're trying to figure out what chronic diseases of aging have always existed throughout humanity and which are a result of the current environment. And so, yeah, so I think what you're doing is really interesting, looking at these community-based groups and seeing what are the problems of today. But I think some of those, like diabetes, so there aren't any fat hunter-gatherers. If you're a hunter-gatherer, you need to be able to be very active in order to get your calories. And if you were to become obese and that was to slow you down, then you wouldn't have those calories and then you would not be obese. And so I think that some of the problems that we face today really are novel and really are due to these built environments that we have. I'm not saying that we should all become hunter-gatherers by any means. And a lot of it actually has to do with parasite load and other things that aren't ideal to have. But yeah, so one of the things that we've been working a lot with lately is a group of cardiologists looking at cardiovascular disease. So if you look at mummies, a lot of Egyptian mummies actually show evidence of cardiovascular disease. Some mummies from Greenland do. Different mummy populations around the world have shown evidence of cardiovascular disease. But the group that we work with wasn't showing any evidence. And so we did gated coronary artery CT scans to look at the actual levels of atherosclerosis in the heart, because most people in the U.S. don't know they have heart disease until they have a heart attack.
Yeah.
And so it's one of those things that you don't know until it's already there. And it's easy to measure something like blood pressure, but it's hard to actually measure true coronary artery disease. And what we found is that groups like the Chimane have the healthiest hearts in the world because they have such an active lifestyle. They have a very different set of dietary parameters, and they also have a very high parasite pathogen load. And there are some aspects of parasites that shift immune function in ways that are potentially beneficial.
Right. So
It's a whole different world now.
yeah.
It should impact what we do with these communities.
Well,
but how?
I mean, to me, one easy solution to describe, not necessarily to implement, is simply pricing mechanisms. Price the externalities back into the food. We're being, and this is not like a political rant, it's just a description of what's happening. Businesses exist, they have a metabolism too. It's to employ people and enrich investors, and their business model becomes manipulating consumers to do things that are bad for them. Whether it's to buy more stuff so that they'll be more sexy and feel better, at least in the short term, to eat more junk because they'll feel better in the short term. So much of this is around the long term and the short term self, however you want to describe that. And there's a woman called Deborah Estern at Cornell who's done these interesting studies around, if you walk out of here and you order ahead, you're going out with your girlfriend Friday night, let's have a nice meal but a healthy meal, and then we're going to watch an uplifting movie, you will order that. But if you leave on Friday night and you just go in a restaurant, you're more likely to order food that is, quote, not as good for you, however that's defined, but more immediately fun, and you'll probably go to a crappier movie. And this is like a microcosm of the bigger problem, and businesses are trying to get you to do things that are more profitable for the business rather than things that are going to prolong your life, because even the businesses are short term. In theory, they should keep you alive as a customer, but the reality is they know the next restaurant over is going to get you later. So.
What other comments from people who have more about it? Well, while the microphone is being passed, I'm just going to mention about my colleague. Heidi Collier at University of Michigan, who did marvelous studies, and what he did is have an array of things that people can taste, varying in their sugar content, their fat content, and their salt content. And he honed in on the exact combinations that would get people not just to eat the most in the short run, but eat the most in the long run. And the craft foods.
And then Nestle hired him.
Big bucks for figuring out exactly, this is the evolution of foods to target our mechanisms in ways that we can resist. It's called the Snickers bar.
That's what they served me in Russia.
They serve
The guy I went to lunch with,
they're so good.
we have this wonderful dessert. The waiter comes out with 2 Snickers bars in their wrappers. Hard currency dessert.
I'm not sure if I can check that. Go ahead.
Just sort of a quick question. With so many potential interventions
Yes.
and the uncertainty of which ones actually do improve public health or which ones do improve health, how do you navigate that very complex space? Because, as you said, success is what's going to be critical on this. And if people make huge investments in, even if they're representative of the community and they actually have ownership and all this other stuff, if they're now investing in something that doesn't actually make a difference, how do you figure out which things to be helping people know what they should do?
Well, I would argue that a sense of agency is in itself almost a success. I mean, here, the diabetes prevention program, it's a pretty crappy program, actually. Its nutritional advice is about 10 years old, or maybe 15 or 20. I went to visit the CDC, and they said, yeah, we kind of know this, but it does other things. It's almost like a Trojan horse. It makes you think about eating mindfully. It makes you focus on don't eat too much. I mean, they're more against fats and more against carbs than I think the current evidence would suggest. But anything that gets you to stop buying food from McDonald's, spend your food more wisely, and yes, do not drink sweetened soft drinks. Cook for your family, serve it with love, have dinner table conversations, get some exercise, and it's all those things have ancillary benefits. And so I'm willing to stake $10 million on this is going to be better than the current version. And so it's like there's a range of what would be the ideal diet. We know what a really, really crappy diet is. If we can move in that direction, even if it's not totally correct. And so I'm on the board of 23andMe. We have people who want us to do, your genetics says you do better with broccoli and you do better with kale. You know, that's a fine distinction. You do better with broccoli or kale versus French fries.
Who's next?
Hi, I was just wondering if you could say more about maybe some of the innovative programs you've seen that seem to be having a positive impact. I understand you haven't gotten all the measurements
Yeah.
done, but is there anything anecdotally that seems to be working that's innovative?
Well, I'm not a fan of innovation. I'm a fan of implementation. And again, our promise to the communities is we're not experimenting on you with unknown innovations that need to be tested. We're helping you do some kind of basic stuff. If you want innovation, I was just at JP Morgan. I met with 5 or 10 really interesting companies doing everything from. So again, there's a spectrum. There's something, I got a cut here and it's infected, and so there's inflammation and pain, and it comes up my nerve and it goes in my head. How much of the pain is here and how much is here? How much do I kind of learn to notice the pain versus the pain is an actual signal? They've got an app that is focused sort of on the neurology of pain, regardless of what the physical initial manifestation of it is. This is the sort of stuff that addiction is a learned behavior, pain is a learned, it changes how, if you do MRI scans, people with chronic pain experience the pain in different parts of their brain from where the pain was originally experienced. It's really fascinating. So that's innovation. It's very untested. We're not going to use it in our communities, but as an investor and that kind of thing, I think that's really amazing. I'm an investor in a company called MedicaSafe that delivers Suboxone, kind of like Netflix. You get a subscription, you get a box, you get a code once a day, depending on whatever protocol. Do you have to call the doctor? Do you have to show up somewhere? Do you have to submit a urine test to a lab? It's for people who want medication-assisted therapy, but it avoids the diversion problem. It avoids the problem of the person who wants to do this but just needs that little extra help maintaining discipline. There's so much cool stuff going on. There's Virta Health, which is a diabetes prevention / reversal, sort of ketogenic diet protocol that I personally believe is probably the best approach, but I'm not an investor and we're not trying to sell it in our communities. If you ask me for personal advice, that's what I would give you. But again, we're trying to just do stuff that will tip these communities over to the create resilience rather than damage people.
So I'm from a nonprofit, and I guess what I was curious about
yeah.
is what kind of creative programs you've seen some of the nonprofits doing that seem to be having positive impact that may be able to be transferable to other communities.
So there are 2 nonprofit things that I think are tremendously exciting. One is Nurse Family Partnership, which has done RCTs up the wazoo. They're based in Denver. They train nurses to take at-risk first-time mothers, take them through to the birth, and then work with the mother and the infant / toddler for 2 years. Fortunately, these nurses were not wearing red shoes, because if they were, they would be required to wear red shoes now. So the downside of this is it's so tightly defined that it's hard to improve on. You can't do the emergent learning because they're so wedded to the RCT. for better or worse. But it clearly works. It may be more expensive than it has to be, but it should be scaled, and I would love to do it in each of our 5 communities. Aside from that, the thing that I think is going to make a difference is the franchise model for training. You know, whether it's training care workers, football coaches, mental health coaches, what our communities need most, if someone said, you know, we'll give you $5 million for something, it would be train our people to deliver care locally and then pay them more than they're being paid now, so that, and there's a company called Cognotion that I just heard of. Do you know them? Okay. So many of the people in our communities are trauma inflicted or trauma informed, trauma afflicted, and they then afflict trauma on their children, on their students. How to reverse that cycle is train people first to confront and understand their own traumas, and then to become caregivers for other people. And that adds employment, it adds dignity, purpose, whatever, and then the recipients of whatever kind of care those people are providing also improve the community. So, yeah, it's not the program, it's the training that comes with the program that then employs the people to deliver the program. Most of these programs sort of work if delivered properly. And again, it's that sense of agency that you give to people. And if you have a sense of agency at work, you also have a sense of agency when you go home, and your neighbors notice, and so forth.
It's a very basic question, Esther. So you have identified, you have identified leaders in the different communities that are going to push forward the concept of Wellville. And then do they actually go out to community groups and share around the support that you can give or the message?
Yeah.
How does it
No.
work exactly?
I mean, the concept of Wellville, again, Wellville, that's us. In Lake County, it's Hope Rising. They don't need to know about Wellville. We help the people at Hope Rising do a better job of what they're doing. And I mean, in each community, we're basically only one person, though we get the communities together, the community leaders together once a year. We go in and out and share things, but we really are more like executive coaches.
So Hope Rising, as far as Hope Rising, I think I remember, is to help the homeless people in the opioid epidemic. Okay, so will that organisation just be focused on that particular group, that needy group, or will they be going? Would that group advise on diabetes prevention, or advise on methods that, or just?
It depends.
Is it very specific in different communities?
Yeah, it's very specific in different communities. So each community again has a different lead organization, and in Muskegon it's 1 in 21. It's more like an umbrella, and there's the YMCA, and then there's a couple of FQHCs, and there's some kind of food as medicine groups. We're trying to make whoever's doing something, we're trying to make them more effective at it. If they're really ineffective, we'd love to see them be merged or whatever. But there's a great book about raising children called The Gardener and the Carpenter. The message is you can't construct your child, you have to kind of garden the plant you've got. And that's what we're doing in the communities. We're gardeners. We're trying to put the fertilizer in the right place and make sure they face towards the sun and get enough water. But it's kind of like being in the Army versus in Silicon Valley, you can hire your roommates and then you can go out and get the very best CFO, and you can get the best scientist from ASU. In these communities, you have to work with what you've got. and you can try and bring in people, and you can bring in training and curricula. You can send them to the Aspen Institute for executive leadership programs. But ultimately, take what's there and make it a better version of itself. Yeah, that doesn't mean we don't have opinions or, our job is to meddle, but we can meddle only so far as we can persuade people, because we have no agency ourselves other than to implant things. I mean, just what Denny said earlier, say it 8 times and then they think they've thought of it.
So I'm very fascinated about what you're doing, and I'm kind of curious about what you see like the long-term vision of this. And also, I particularly work on malaria, so I'm working a lot with communities in Africa, for instance, where there's loads of problems that are different than what you find in your communities. But in a way, it's similar as well.
Yeah.
So, for instance, HIV prevention is a big issue. And the issue that I often see in African villages is very top-down approach. And it's Western people think they want to help the community, they come down, they tell them how to do it. And often that doesn't work, right? And things are changing, and people know you have to talk with the community leaders. But still, do you see the lessons that you've learned in those communities, how they could be transferred to a very different setting, for instance, the average African village, for instance?
So, I mean, the reality is you're going to, nothing I've told you today is that surprising, right? It's just a question of doing it and having the humility and the ability to listen. We're such smart, well-connected people. We come in with all these great ideas. But unless we can present the ideas in a way that's relevant and focused on what people perceive as their problems. I mean, again, I will try to make them perceive the long-term nature and the long-term approach to dealing with their problems. But if you're not relevant to their problems, like the flu vaccine thing, it ain't going to happen. And so it's totally relevant to Africa, but the specifics are totally local. And that's kind of even between African villages. So, yeah, it's the point is, what I'm saying is very, very theoretical. The actual delivery is so practical and local and specific, and it depends on, as it happens, the guy who runs the YMCA is the brother of the guy who used to run Mercy Health. And ironically, because they were brothers, they wouldn't communicate about, they didn't want to be nepotistic. And it took a lot of work to get Mercy Health actually to work nicely with the DPP program in Muskegon.
We have to wrap up in just a second. Anyone who'd like to continue the conversation can join us for tea just outside. And I just want to say that I really wish, Esther, I could have had you talk to some of my psychiatry residents. Because in fact, what she's really doing is therapy for communities, starting with where the communities are and trying to help them use what abilities and strengths they have instead of just telling them what they should do different, which does not work. Thank you so much, Esther.
Thank you.